Hello, my name is Jude Cooper. I'm Head of Occupational Health and Wellbeing and have worked in the NHS for 30 years. Every winter there is a possibility of a flu outbreak, and this would have a serious impact upon this trust and all other trusts. Every year all NHS staff are offered a free flu vaccination, and I believe this is the best method of protecting the individuals, the patients, the family and their friends. But don't just take my word for it. Here are some of the facts from my colleagues.
Hi, my name's Rachel Weddle and I'm the Head of Nursing for the Forensic Service based in Rosebery Park.
My name's Tracy Hadwin. I'm a clinical lead nurse on Birch Ward at West Park Hospital.
My name's Jean. I'm Public Governor for Hartlepool.
I'm Carol. I work in HR operations.
My name's Jason Highland. I work in finance.
Hi, I'm Lorraine O'Neill. I'm a learning disability nurse, worked in various areas.
My name's Angela Ridley and I'm the Head of Infection Prevention and Control for the Tees Esconway Valley Trust.
My name's Elizabeth Moody. I'm the Director of Nursing and Governance.
Hello, I'm Russell Smith. I'm the Health and Wellbeing Lead for the Trust. I've worked in the NHS for 28 years.
I'm Helen. I've worked in HR with the Trust for about 8 years now.
I've worked in the NHS for nearly 39 years.
I'm into my 4th year now in that role, and I'm also a carer for my husband who has Alzheimer's.
I've been in the NHS as a nurse for 37 years now.
I've worked for the Trust for 20 years.
And I've worked in the NHS for about 30 years and I've been with Jude for the last 2 years.
I've been working for the Trust for 28 years. And basically I get the flu jab because I'm protecting myself and protecting my family.
My kids, my family and obviously all the people I come into contact with at work.
Not only do I think it's important to keep yourself healthy, I think it's important to think about your colleagues.
I'm not just looking after the patients on my ward.
You can have the flu without displaying any symptoms, and therefore you could be going home and, transferring the flu, giving the flu to members of your family, some people who are very vulnerable in your family.
Well, certainly my 1-year-old daughter.
It's very important to make sure that we're all protected against the virus.
5 years ago, I actually got flu, ended up with community pneumonia, was quite poorly.
I had the flu myself just over 20 years ago, and I remember it well because it was so frightening.
So I was off work for about 3 weeks.
You will have a soaring temperature, you will be aching from top to toe, you will be unable to go to work, you would be unable to look after your children, your family, anybody that you care for.
I felt as if my lungs were filling up. I thought I was drowning. I was frightened to lay down and go to sleep.
From then I've had the flu vaccination every year and I've never had it back.
Not long after that I was offered the flu injection because I have asthma.
As a child I suffered from asthma, so I'm always aware of the increased risks around flu.
And I took it up and I've taken it up every year since, and I'm glad I do.
Genuine flu is potentially life-threatening, severe infection, and it does cause a number of fatalities every year, including among previously young and healthy people.
The flu doesn't just affect the old, the vulnerable, children, it affects everybody.
What happens is that the virus changes every year, the vaccination changes every year depending on what's happening in the world.
It will reduce the symptoms if you were to get flu, and for many people it gives you a full protection against the virus.
Care homes, there's always some sort of infection going round. My husband's 83-year-old nearly, and so I've got to be careful really what I take in with me and also what I bring out.
You may have a sore arm afterwards. You may develop a little bit of muscle stiffness in whichever arm it's given.
It doesn't contain a live virus, so therefore it's impossible for it to give you the flu.
It's just a protection thing rather than a live antibody in there.
Keep yourself hydrated with water. Within a couple of days, it will pass.
All the years I've had it, I've had no side effects. In fact, they tell you it's just a little scratch, and that's actually all it is.
It takes 2 minutes to do, it doesn't hurt, never suffered any side effects.
And it's free, so...
Look out for your local chief flufighter who can give you a vaccination. Look out for a flu clinic held across the Trust. from October.
We do make it very comfortable, it'll be very private, we do have a room.
If you look at flu pages on In Touch, that will give you all the information about the Trust flu campaign for this year. And of course, Vera the Vaccinator is back across the Trust, so seek out Vera for your flu vaccination. Get your flu jab.
So this year the campaign is about keeping you and me healthy. So